Welcome to the We Level Up Treatment Center video series. In today's video we will discuss inpatient effective inpatient alcohol rehab treatment levels of care, alcohol therapy types and alcohol detox programs. There are many treatment centers that offer services for alcohol addiction. Usually, treatment centers provide individual counseling, group support, and detoxification services. It is important to do your research and talk to your doctor or therapist to determine the best treatment option for you. Alcohol addiction treatment centers that offer intense inpatient alcohol rehab allow patients to live there while receiving specialized therapies. Depending on the needs of the patients and the treatment institutes, different therapies may be used in inpatient alcohol rehab. Inpatient alcohol rehab patients typically have the choice to have loved ones visit them at specific times of the day or week in addition to eating their catered meals and sleeping in their selected facility. The times of visiting and the number of visits usually depend on the patient's progress and the type of rehab facility that they are in. There are usually guidelines established by the rehab facility in order to ensure that patients' health and safety is the top priority. Inpatient alcohol rehab facilities provide a method that is quite rigorous for treating alcohol addiction thanks to their strong support and daily schedule. What is the difference between inpatient versus outpatient care? Inpatient alcohol treatment requires the patient to stay 24/7 at the treatment center. This way, the patient is fully monitored and constantly given support and encouragement throughout the course of their treatment. Depending on the severity of the addiction, an inpatient program can last anywhere from 4 weeks to 3 months. In contrast, outpatient alcohol treatment gives patients the choice to attend sessions while continuing to live at home. In addition to these potential treatment specifics, a period of stay for any kind of treatment facility might be required. Studies suggest longer treatment regimens for better treatment results. What are local inpatient alcohol rehab near me options? To find local inpatient alcohol rehab options near you, the best place to start is by doing an online search. You can look for specific treatment centers or look for broader networks offering inpatient programs that are closer to your location. Additionally, you can check your local yellow pages and call the number on the back of your insurance card for more options. If you are not sure which services are available in your area, you can call us at. Our team of experienced advisors is available 24 hours a day, 7 days a week, to help you find a program that is right for your needs. You can also visit our website, www.welevelup.com, for more information. We offer a variety of resources to help you make the best decision for your unique situation. What is alcoholism? Tolerance and withdrawal are two key indicators of alcohol addiction. First, following repeated exposure to alcohol, the body develops a tolerance to it. A person needs to drink more alcohol to have the intended benefits as their tolerance grows as their body adjusts to drinking and needs to do so in order to function. Additionally, the body starts to depend on alcohol because of how it affects its chemical composition. Withdrawal is the second indication. These signs of alcohol withdrawal are risky since they may be lethal. The second stage's physical symptoms include stress and anxiety, a quickened heartbeat, confusion, nausea, the urge to urinate, and insomnia. These are actual, undeniable indications that assistance is required if a person suffers these symptoms yet keeps drinking to ease the agony. Inpatient alcohol rehab substance abuse diagnosis. Which sort of rehab is ideal for you will depend on your needs and how serious your substance use disorder is. We Level Up employs skilled and accredited professionals that can assess your addiction and provide you with the most effective treatment options for a speedy recovery. To diagnose addiction, we employ a variety of techniques, including lab tests. The most thorough treatment for addiction is accessible in inpatient alcohol recovery programs. Patients who misuse medications and alcohol risk dying as a result. Attending inpatient rehab facilities gives you the best chance of becoming sober and keeping it that way. Patients at We Level Up have the chance to rehabilitate thanks to structured programs, staff support and direction, and professional treatment staff monitoring. What are the levels of care for inpatient alcohol rehab? There are many levels of inpatient alcohol rehabilitation, and the majority of residential rehab treatment facilities address alcoholism alongside addiction to other drugs or substances or co-occurring mental health issues. The most effective inpatient alcohol rehabilitation programs are those that are tailored to the needs of each client by implementing a mix of therapeutic strategies. The inpatient alcohol treatment approach for each client's alcohol use disorder may include a specialized mix of behavioral therapies, involvement in peer support networks, like 12-step programs, and medication-assisted treatment, MAT, if required. Behavioral therapies administered by trained therapists or counselors are the main focus of behavioral treatments, which aim to change detrimental drinking habits. Participation in a mutual support group could entail going to a 12-step meeting like Alcoholics Anonymous, AA. Members of this confidential group can get support from their peers who are also in recovery from an alcohol use problem in meetings of Alcoholics Anonymous. And other 12-step meetings. Naltrexone, acamprosate, and disulfiram are the 3 drugs that are currently authorized in the United States for the treatment of alcoholism. The ideal way to use these 3 drugs is in conjunction with behavioral therapy. Each of these medicines needs a doctor's prescription. What are the different types of inpatient alcohol rehab programs? Inpatient residential rehab and partial hospitalization are the 2 main categories of inpatient alcohol rehabilitation programs. Depending on factors such as the degree of the person's alcoholism, how long they have consumed alcohol, their financial condition, and other factors, your doctor or an addiction specialist may advise one sort of treatment over another. Consider the advantages of each choice, the therapies that are provided, the length of the program, and the availability of financial aid before making a choice. Inpatient treatment is one of the most widely used approaches of treating alcohol use disorder, or AUD. It comprises checking into a rehab facility and staying there while receiving treatment. You can snooze soundly knowing that help is constantly accessible because you'll have 24-hour access to doctors and other specialists. For inpatient treatment programs, there's also a set daily schedule that includes breakfast in the morning, therapies, counseling sessions, and activities for the remainder of the day. An inpatient rehab facility is open to anyone seeking treatment for alcoholism. However, a number of causes and danger factors have an impact on the suggested alcohol addiction treatments. Age, mental health, substance abuse, medical history, effective medical alcohol detox. Getting alcohol out of a person's system is one of the first steps in the rehabilitation process. Patients typically start with alcohol detoxification with medical assistance. Patients are under constant medical supervision while residing at an inpatient alcohol rehab facility as they detox from alcohol. To ensure their safety and comfort throughout the alcohol withdrawal process, patients receive treatment from alcohol detox centers around the clock, 7 days a week. As the body recovers from alcohol withdrawal, we try to keep our guests as physically at ease as we can. Medical personnel are prepared to help in any way that may be required. The objective of alcohol detox treatment is to reduce negative effects as much as feasible while making the patient more comfortable. The first step before a more extensive treatment program is alcohol detoxification. Inpatient facilities are preferable to outpatient ones for conducting alcohol detoxification safely. For heavy drinkers, round-the-clock medical supervision is advised. The detoxification procedure typically consists of 3 steps. Intake. The medical team will do a sweeping review of the drug, medical, and psychiatric chronologies for each incoming patient so as to thoroughly understand each case. Medication. Many detoxification programs incorporate medications that emulate the effects of alcohol to lessen withdrawal symptoms. Medications may also target co-occurring disorders or help make withdrawal more comfortable for the patient. Stabilization. The patient undergoes medical and psychological treatments to enable them to reach a balance of mind and body. Individualized inpatient alcohol rehab center. It's time to make a treatment plan after the detoxification phase is finished. A focused care team meets with each individual to discuss their unique needs and concerns. Since no 2 people are the same, neither are their rehabilitation journeys. Every treatment strategy needs to be unique to the patient. Who is inpatient alcohol rehab for? Effective inpatient rehab for alcoholics is believed to be most beneficial for those who have serious alcohol dependence and addiction. Many types of treatment participants can benefit from an inpatient program due to the diversity of treatments provided in an inpatient alcohol rehab clinic, including Individuals with mild, moderate, or alcohol or drug use disorders. People with comorbidity or co-occurring substance use disorders and mental health issues. People with co-occurring mental health disorders, such as depression or bipolar disorder. People who need special accommodations, such as pregnant women, teens, veterans, or executives. Individuals who need specialized treatment, such as a gender-specific program. Individuals who need to stay longer in substance abuse treatment facilities to overcome co-occurring issues that affect substance abuse, such as domestic abuse, trauma, and drug-related crimes. People who need substance abuse treatment but must complete it quickly and efficiently for specific reasons, such as parents and people with demanding careers, CEOs, hospitality workers. Regardless of the type of person seeking treatment, care in an inpatient alcohol rehab facility can aid in overall health restoration, drug and alcohol cessation, development of skills and mechanisms for ongoing abstinence, and the creation or reconstruction of a meaningful and fulfilling lifestyle that supports a full recovery. Chronic alcohol use can lead to serious health complications. Short-term and long-term consequences are two main categories that can be used to categorize the health effects of alcohol misuse. However, there could be short-term side effects including a rise in blood pressure, an irregular heartbeat, or even an overdose. Heart disease, lung disease, and liver disease are only a few of the long-term impacts. Additionally, according to the National Cancer Institute, there is significant scientific agreement that drinking alcohol can increase the risk of developing a number of cancers, including head and neck cancer. Moderate to heavy alcohol consumption is associated with higher risks of certain head and neck cancers. Esophageal cancer. Alcohol consumption at any level is associated with a higher risk of a type of esophageal cancer. Liver cancer. Heavy alcohol consumption is associated with approximately two-fold higher risks of two types of liver cancer, hepatocellular carcinoma and intrahepatic cholangiocarcinoma. Breast cancer. Epidemiologic studies have consistently found an increased risk of breast cancer with increasing alcohol intake. Colorectal cancer. Moderate to heavy alcohol consumption is associated with 1.2 to 1.5-fold higher risks of cancers of the colon and rectum compared with no alcohol consumption. That's it for today. If you like our video, please let us know. Have a great day.